Grab a drink, sit back, and explore the paranormal with us. Welcome to the Necromancer Live Show. This stream will begin in time. Thank you for your patience. Grab a drink, sit back, and explore the paranormal with us. Welcome to the Necromancer Live Show. This stream will begin in time. Thank you for your patience. Grab a drink, sit back, and explore the paranormal with us. Welcome to the Necromancer Live Show. This stream will begin in time. Thank you for your patience. Grab a drink, sit back, and explore the paranormal with us. Welcome to the Necromancer Live Show. This stream will begin in time. Thank you for your patience. Grab a drink, sit back, and explore the paranormal with us. Welcome to the Necromancer Live Show. This stream will begin in time. Thank you for your patience. Grab a drink, sit back, and explore the paranormal with us. Welcome to the Necromancer Live Show. This stream will begin in time. Thank you for your patience. Grab a drink, sit back, and explore the paranormal with us.
As far back as I can remember, I dreamt of a normal life. A life filled with normal things. A life where monsters don't live in closets or under the bed. A life where ghosts aren't real. I just wanted to be normal. But that didn't happen. It wasn't meant to be. Since my early 20s, I have experienced profound paranormal events that would change my life. Extreme poltergeist activity, living amongst those that have departed this earth in ways unimaginable. It has affected my loved ones and children with no end in sight. I could hear things, see things, and feel things not of this world. I asked myself if this was a gift or a curse. With the help of my mother and close friends, I emerged a paranormal investigator. Since 2013, I have been on a relentless journey to learn about the paranormal. I invite you to follow me into the unknown. Welcome to the Necromancer Live Show.
Cool.
Hello, and welcome to the Necromancer Live Show. I'm your host, Justin Brown, and we have another exciting show for you guys. Thanks for joining. Please feel free to share the stream. Get everybody you know in here right now, because we have another very, very nice, interesting guest tonight. Donald Molnar. He is a doctor, okay? Doctor in the house. We got smart people here. What's up, man?
Not much, man. Thanks for having me on.
Yeah, thanks for coming on, man. It is my pleasure. It's always cool to get people in here from, really interesting, fields of work. Doctors definitely deal with the fringe of life and death a lot. So they get front row seats to what is our mortality. And
True.
it's fair to say that there has to be, I don't know, infinite amount. It seems like an infinite amount of stories and experiences nurses, doctors, healthcare people experience. And it's interesting that people who've had personal experiences early in their life kind of leads them to certain fields of study, which, in your case would be healthcare. And it makes sense to me that, people who want to help people heal and get better and not die would be sensitive to, the idea of passing from this world into whatever else is out there. So you do have kind of like this, let's just say, an empathy for people who need help, without saying, right?
Yeah, I think so. Yeah, you can kind of pick up on people suffering, and you want to try to help them. And yeah, I think we all as physicians, we even healthcare providers generally, we have this kind of innate desire to help folks, and you kind of can sense when somebody's maybe not feeling well or having problems. And you're compelled to want to try to help people, even people that won't help themselves. Like I was taking care of some people that abuse IV drugs and got heart infections and infections to their brain because of all this, and you still want to help them. You feel they, they're in a way crying out for help, and you want to try to help them live a better life and all that stuff, even though they're not doing a lot to help themselves. So there's this desire to help folks.
Yeah, and I totally relate with that. It seems like the world increasingly needs more people who would provide some type of care, whether it be mental health, actual medical help, or just being there, just having someone there to know that people actually care about them and are willing to dedicate a huge chunk of their life, to do that. And of course, I don't think a lot of doctors, they just can't get paid enough to do what they do, and it's such a sacrifice as far as how much schooling it takes and how much time shifts can be, and what they have to endure just to do that field. It's a lot. So I do appreciate that you have been awesome enough to do that.
When I think the people that are really kind of under recognized are the nurses too. I mean, what I do is it's I got to be thinking, and I make life and death decisions for folks all the time. But really, the nurses and the nursing assistants and those kind of folks kind of get. I mean, they're like on the front lines. A lot of times for us docs, we kind of get in it. Like I go see a patient, I get in, get out, spend maybe 15 minutes, half an hour. Sometimes you circle back around. But the nurses and the nursing assistants, I mean, they're in there on a 12-hour shift. I mean, they're dealing with stuff. A lot of times those docs can kind of bail out and go somewhere and get a break. But yeah, I think healthcare providers across the board, but doctors and nurses. But I think the nurses too need a lot of they should get a lot of recognition, and the nursing assistants. And it's the nature of the beast. When people are suffering, they're at their worst a lot of times, and you end up putting up with a lot of stuff from people sometimes. trying to get them better, and just got to realize that people are kind of acting out and they're upset because they're sick, or the families are upset because they're sick. So you end up taking a lot of you take a lot of non-medical. You have to deal with a lot of non-medical things when you're caring for certain folks, especially the nurses and the nursing assistants and that kind of thing. So, and doctors too. We gotta, you find yourself explaining yourself a lot of times to folks who probably really don't understand what you're saying, but they're still giving you a hard time. And
Right.
so yeah.
So let's get into your bio here. You practice internal medicine, hospital-based physician who is also interested in the existence of the afterlife, spirits, ghosts. You started investigating for spirits and ghosts in 2012, and in 2018 you launched Haunted M.D, which also allows him or you to combine paranormal investigating with the science of being a physician, which is awesome. That's what
Thanks.
that's what I want to talk to you about, along with paranormal investigating, his interest in near-death experience and other topics in parapsychology. So, why don't you start off with the experiences you've told me about when you were young, way before you knew you were going to be a doctor? Maybe you knew, but let's start talking about the highlights of your paranormal experiences growing up.
Sure thing, man. So a long, long time ago.
Galaxy
So a long
far
time
away.
ago. So pretty much all my life, and this is no exaggeration, and I'm just reporting on my experiences. So some of my earliest memories as a child, I remember having strange things happen. One of the things I talk about, that I remember pretty vividly, and actually I talked to my mom about this recently, probably about 2 weeks ago. I was talking to my mom about this. Is I used to see my earliest experience. I would see like a child-sized figure of light. It had shoulders, a head, arms, legs, but you couldn't see any detail. Like there wasn't any facial features. You couldn't see clothes. It was just this, human shaped, child shaped figure of light. And I would see it peek around the corner, like it would peek around and go back, peek around, go back. Sometimes I'd see it run across the living room or those kind of things. And I remember saying to my mom, like, "Mom, I'm seeing this child like, or this, I'm seeing this thing looking at around the corner of me." And my mom was really cool. And I'll talk about that some more in a little bit. But she rolled with it. And she was like, "Well, that's just your guardian angel. So don't be worried about it." And we were talking about this about 2 weeks ago. I said, "Mom," I said, "do you remember back when I used to see that, when I saw that child, that light figure?" She goes, "Oh yeah." She goes, "You always talked about that." And do you think I was really seeing something?" And she said, "Yeah." She goes, "You seem like you were really seeing something." Because I was curious. I'm always, I think, being being the person I am and being a guy of science, you always kind of going back and reassessing and reassessing and reassessing. And
Sure.
I really see that. And my mom was like, "Yeah." She's like, "You were really, yeah." She goes, You seem like you were really seeing something, experiencing something." And so yeah, so that was one of my experiences kind of growing up. And then kind of to get into the whole family thing real quick, my mom and my dad were pretty open to the paranormal, and I kind of grew up in this environment where we just talked about that stuff all the time, ghosts and Bigfoot and UFOs. I grew up in Ohio, in Lorain, Ohio, up on Lake Erie, and I don't know how much you know about Lake Erie, but it's just a hotbed of
Oh yeah.
UFOs, ghost ships, and Bigfoot, and creatures, and witches, and you name it. And so it was kind of like it was like destined that I would be a paranormal guy. But my mom was real spiritual and religious kind of. She was raised Catholic, and she wanted to make sure that we kind of knew about Jesus and all that kind of stuff. But it wasn't like, it was cool. It was kind of laid back, and she was real open to talking about heaven and angels and ghosts and things like that. And besides, my mom was one of those people, and she still is, that everything comes in threes, right? Everything comes in threes. And then my dad, he was somewhat religious, never really went to church. He was more Protestant, kind of Christian. Um, but he was the paranormal guy. He was like, the Bigfoot and all that kind of stuff. So we were always just we had a real open forum. We always talked about it. Like, even like I was saying 2 weeks ago, me and my mom were talking about the old days and the ghost and all that stuff. And so we just had this environment. But, um, so we had that open forum. And then pretty much I just always seem to have weird things happen. Like, I was talking to my mom recently about one of the things I had happen around the same age as this child of figure of light. Was I'd hear my name, I'd hear Donald, and I'd go running downstairs. I'd be upstairs, and I swear that they called me. and nobody had called me, but it was like this distant male voice calling my name, and my dad and mom swore they weren't calling me, and it wasn't the neighbors or anything like that. So I'd hear stuff like that, or I'd hear disembodied footsteps. One of the things I talked to my mom recently is I think I saw my mom's doppelganger in a sense. It was in that same house where I saw the child figure running around. I was outside playing, just like in the 70s. We played from sun up to sundown. The sun was going down. I wanted to come in the house. Went to go in the back door. I was knocking on the back door, and they had curtains on. There was a window on the door. The curtains parted, and my mom was standing there, or at least what I thought was my mom. And she had this evil smile on her face, like big teeth, and just scared the crap out of me. And she would not open the door. And I was like freaking out, so I ran around to the front door. I was banging on the front door, and nobody would come to the door. Went back to the back door and banged on the door. This time, my mom opens the door, and she's like, "What's wrong? What's going on?" I'm like, "Mom, you were like standing in the window laughing at me, and you wouldn't open the door." She's like, "Don, I was upstairs in the bathroom. I couldn't get downstairs." She said, "I heard you, but I couldn't get downstairs." So I saw my mom, or at least what I thought was my mom, but it wasn't because she was upstairs in the bathroom. But it was somebody that some apparition was looking at me through the door. Yeah, laughing at me. So and I asked my mom about that. I go, "Do you remember that?" She goes, "Yeah, I remember that." She goes, "I don't know what you saw." She goes, "But yeah, that was crazy."
Yeah,
So anyway, let me stop
that's
there 'cause
interesting.
I got so many stories, man.
Okay.
But go ahead.
Well,
What kind of question?
Missy, do we have any questions yet? Oh, she.
No.
No. Okay. So,
I can go on, ramble on if you want.
well, we can take periodic breaks in between. We'll do this. I know you have a lot of, I can tell that you've had a lot of experiences, Don, and I'm telling you, you have psychic abilities. Okay, a lot of them. All right, the ones that I'm picking up on from what you're telling me is, the gift of sight and the gift of hearing, what they call clairaudience. Yeah, that's of knowing too, and we haven't got there that part. Maybe he's had experiences where he's had intuitions or gut feelings about.
Yeah.
So it seems to me that, and it's probably hereditary, that you have what they call psychic ability, and it's not that you have this superpower. Everyone's got it, whether some people have a lesser version or it doesn't develop in their cognitive faculties and their conscious set that they use to bring in stimuli from the outside world. Some people are just naturals at it, and it seems like you are, especially at a young age, until you beat it out of yourself, and life will tell you that there's no such thing as ghosts. I know it sounds like you had a healthy environment for this, so that's probably why you're still in the field of interest when it comes to that sort of thing. But it seems like as we get older, we see less, we experience less, and that's just life. It's kind of like conditioning, with lack of a better explanation for that. But for the people I've interviewed, which is over 100, I would say by now, over the couple years I've been doing these shows, it starts early, and it's not like an everyday thing, but when things happen, they're pretty profound and they're pretty noteworthy. And it's interesting that when they tell you that they see certain things and they hear certain things and they feel certain things, it seems like there is a pattern. And everything that you've told me thus far, there's patterns in all the stories and anecdotal evidence of these sightings that I've heard about, people talk about, that are just spot on. And you were experiencing these things before you could be influenced by stories.
Right. I had no idea. Yeah.
So that right there, common sense just tells you people are experiencing these things. Whether they are ghosts or spirits or angels, that's besides the point. The point seems to, be there is something going on that we cannot explain, but something does exist. It's not like a figment of our imagination. Is that what you've kind of come to terms with?
Yeah, I think, especially when I never thought about this, but now that you bring it up, as a kid, I didn't know, like when I was seeing that light figure, I had no idea. I'm just like, I didn't know what to make of it. I mean, I wasn't really scared of it, but it was puzzling to me. So yeah, I was, nobody had talked to me about light figures, or ghosts or anything like that at the
Wasn't taught to you
time.
in Sunday school.
Yeah, no, yeah. So and then even like hearing my name called, and I didn't know what that meant. I thought somebody's calling me, and even that whole thing with my mom, I didn't. To For all sense and I mean, for all purposes, I thought I was seeing my mom the first time. So it was crazy. And then but as these experiences started building up, I realized that there is something otherworldly going on here. And then we started, as more things would happen, we started talking about it more. And the interesting thing in my family is we would a lot of times have independent experiences, and we didn't know it. Like as I got older, we moved to a different house, and the quick story that we had was we had a pool table in our house, and sometimes at nighttime, me and my dad would shoot pool. My dad worked; he was a steel worker, and he would come. He worked all kinds of oddball shifts, but sometimes he would come home late, and he'd want to shoot pool, and he would wake me up, and I would go down and shoot pool with him. I was like a teenager by 12, 13, that age group. So I would shoot pool, and me and him would play pool. And one of the phenomena that we both heard independently, and we didn't realize it was, we would hear pool balls breaking. Like one night, I remember I heard it sounded like my dad was shooting pool. I mean, I heard the balls break and falling into pockets and all this other stuff. So I went downstairs because I thought he was playing, and the pool table was covered up, and the balls were on there on the wall, on the rack on the wall, and it was like, what in the world is this? And but then we were all sitting around the table one day, and my dad's like, out of the blue, he's like, "Hey, the other night, Don, I thought you were shooting pool." He goes, "I came downstairs because I heard the pool balls." And he goes, "There was," and the same thing happened to him. So we had
Yeah.
those kind of like independent validation type things. And even my mom remembered those. We were talking the other day about this. And, we would all, another thing we did as a family, we'd smell strong scents of roses. And my dad's dad died before I was born, and he was really into roses. So we thought it was his spirit potentially, because he grew roses and he had this beautiful rose bush at the house where my dad grew up. And so we thought it was Grandpa Molnar visiting us all the time. And we used to every now and then try to connect with him. And my mom reminded me the other day, she goes, "We used to smell baked goods too." She's like, "For no reason, you would smell baked goods like a pie cooking, and there was there was no reason for that." And then but the roses and all that kind of stuff. So those are the kind of some of the experiences we had, growing up, and and all that kind of thing. So, but that kind of followed me even till now. I mean, even here in my townhouse, I was, you hear weird things and see weird things, and so it's kind of all my life. I've kind of just had this. I don't know. It seems like maybe you're right. Things are drawn to me, and I kind of just it's kind of just something I accept.
I find the term high strangeness fitting.
Yeah.
The lines of the classical physical world that we think you had the story about the billiard balls. I mean, the classical physics version of what we think of the world, there's cause and effect. The ball rolls across the table, hits another ball. For every action, there's opposite and equal reaction. That's a classical physical world that we all know and kind of subscribe to because that's what normal is. But it seems that some people experience things outside of that, framework. What the pool ball story, the doppelganger, it's all theories, but it just seems to me that the lines of time and space can blur. Yeah. And when your family is experiencing it, you have to ask questions. Is it the location? Is it the time? But it seems to follow you.
Yes.
Through time and space, wherever you move, this phenomena seems to follow you. So it seems to stem around the family or the individuals.
Yes.
And that is the most interesting thing it's got to be from a parapsychology point of view. It's the consciousness. It's how they're interpreting the data around them, how they're perceiving reality. And it seems to be lining up. That's hearing the pool balls, Mom might be hearing some of the same things you guys are seeing and hearing, and it's interesting because it does seem like there is a genetic line. It seems like if you have it, Mom has it, or maybe Dad has it, or maybe Grandma or Grandpa has it. It just seems like that. Everyone I talk to, so you begin to ask yourself.
That's reported, especially especially among women, it's passed down like psychic abilities. I mean, that's been reported a lot about it runs in families. My mom, I mean, she does seem to be a little bit of a sensitive, and she would get those hunches, and suspicions and things like that that would sometimes come true. And but yeah, I'd say my mom probably had a little bit. It was a little bit of a sensitive. My dad, I don't know. If he was more of a sensitive or he was just really interested in it. Now his mom was involved in the like occult kind of stuff. Like she was interested in voodoo kind of things and stuff like that. So I don't know. So I guess it could maybe it's on both sides of the family. But yeah, my mom I think tends to be a little more sensitive and all that kind of stuff. So
Well, women tend to be because they're not, judged and bullied as much as men when it comes to, that kind of stuff.
well, the other thing I haven't really talked about this very much on other podcasts is I used to have a lot of deja vu. Like when I was a kid, and I don't get it so much now, but I would I would be able to I would know like it was that you never knew when it was going to happen, but you know, it was a deja vu. Like all of a sudden, for a few seconds, I knew I had dreamt what was going to happen, and I knew, but it was hard to know that the time difference between when I had the dream and when I'd actually experienced stuff. When I was a kid, I had a lot of deja vu too. On top of that, on top of having the hunches and all that kind of stuff. But I remember every now and then I could kind of sense when it was happening in the dream, and I would try to see if I could control it. But you can only have a few snippets of it, but it would be something that would happen into the future. So I would actually dream a few seconds of the future, and then I'd be living that and be like, wait a minute, I dreamt this. I know it's going to happen for the next split second or two. So that was always an interesting phenomenon too.
Absolutely. The more and more things you're saying, I had the same things younger. And doesn't it seem like time and space, they become blurry at some points, especially with the deja vu. The science field likes to say, oh, it's just like, a glitch in your memory or something like that. No.
There's more to
No.
it. I've seen there's some recent studies out now saying they think they can explain it, but I think there's something more to it than what they're saying.
Doug,
Because like when
I was going to say real quick, Doug, I'm going to butcher his last name.
Yeah, I saw his name come up. I did.
Okay.
A podcast.
You saw, okay.
Okay.
Yeah, they're up from Canada. They're up in Canada. They're great guys.
I just wanted to say that he said hello. Sorry to interrupt.
Hey, hi, Doug. Yeah, I was on their show, and I keep in touch with them. They're awesome guys.
Awesome. Did you lose track there because I interrupted you? About the deja vu.
But no, the deja vu, it's one of those things. It's like seeing a ghost. It's hard to really get people to understand what it was. It's easy to try to come up with potential explanations. Hallucinations, na. But if you're the person it's like seeing Bigfoot, right? It's like when I haven't seen Bigfoot, but people have seen Bigfoot. It's hard. I mean, when you see Bigfoot, you see him, and it's something that's very real. Like a ghost. When you see a ghost, it's a very real experience. And yeah, there's all these potential explanations, but it's so hard to convince somebody that this was real. So deja vu, what I'm getting at is, I don't know how yours were, but mine, like I knew for a fraction of a second, I knew exactly what was going to happen, and I was able to kind of remember it. I'm like, I dreamt this. I dreamt this back a while ago, and I knew what they were going to say, and they did, and I knew this was going to happen. But it's only such a small little segment. But it's if you don't have them, it's hard to relate to it. But it's a real, for those little fractions of time, you've already dreamt that or experienced that, and it's not like a familiar place. It's not, a memory. It's something. What's going to happen, right? I mean, is that how yours were?
Yeah. Now, my brother had them a lot, and he would know that he dreamt it. It would be like the week before, or it could be years before. Doesn't matter. But he could recall specific dreams because I think they were reoccurring dreams. And it would be like you said, it would be a snapshot of a scene.
Yes.
Pulling up to a stop sign on the back road, for example. That snapshot would be like, oh, I've been here before, or I've dreamt this before.
Yep.
So for me, I can't remember my dreams super well because I definitely I've had sleep apnea for a long time, and I just can't really recall a lot of my dreams. But I know that I was there, and it would be a snapshot. The last one I had was years ago. I was doing landscaping, and it was the corner of a mulch bed. Means nothing. There's no significance to a mulch bed. Okay. But that snapshot in that moment triggered a memory. And it's interesting. I don't think it's the actual information of or what's going on. I think it's the timing of in that moment letting you know that there was some type of detail that kind of triggered a memory that you've had prior. It really doesn't. I don't believe that. Maybe sometimes it does, but it's not the specific thing that triggers it. But it's just, letting you know that time may not be as linear as you think it is.
Well, for me, a lot of them, a lot of the ones that I had when I was younger, it was involved, other people being in it.
Mm.
And when I realized I was experiencing the little snippet of something I've already experienced before, I kind of knew what was going to happen. Like I knew they were going to say this and do that in a fraction of time, and they did it. So yeah, I guess it could be some kind of the memory of a dream, but it was like I already knew in advance what they were going to do for a fraction of a second, and they did it. And because then you're like, holy cow, I'm re-seeing this again, what I saw back when I dreamt it. So it's like they do the same things, and the outcome of that particular thing, depending how long of a snippet it is. So that's the kind of things I've experienced. And then there was other ones too where you're just like, where it just felt familiar, like I think I've been here before because it's the same room or whatever. So that makes me think scientifically that maybe that's just triggering some kind of memory from before. But these other ones that were more involved and more detailed, where you almost knew the future for a second, and those are, to me, it's hard for me having experienced it, to say I just had a memory triggered, like yeah, for some reason I was able to see a fraction of the future, and then I remember I saw that.
Yeah, there's got to be more to it, but to study something like that would be extremely difficult. I would.
Yeah.
Can I ask a question?
Sure.
Have you ever had that with a patient?
Not so much the patient, but when I work, last one I had, I was at work at our other building, and I'm like, holy cow, I think I know what's going to happen here for the next second or so. But it was, more like this work, being around the nurses or being at the workstation or something like that. But no, not about a patient now. And most of them were when I was young, like, 5, 6, still teenager years, a little bit as a young adult. And then, probably about a couple of months ago, I had another little one where I had a snippet of being at work. But yeah, what makes you like? What are you thinking with that?
Well, I just, like it sounds to me like you've just shook it off. Like, you don't want to know the future, so you don't want to know the bad news that you have to give this patient or whatever. So you just kind of shook it off. You know what I mean? Like that ability.
Like there's some resistance, like unconscious resistance.
I think I do downplay it. I think I deny stuff. Like I don't think I'm psychic, but on the flip side, I do get a lot of hunches, and I do seem to clue in on things. But I stop short of really thinking I have any abilities. But I do get hunches, and a lot of times they're right, and a lot of times you're like, oh, wish I would have went with my gut, and I didn't. And but yeah, so I don't know. But I think even with the deja vu, I don't talk about it much because it's I do kind of doubt them, but they're very real,
Yeah, I think for people who like to stay grounded, especially doctors, I would imagine, what kind of eggshells you have to step on when it comes to getting respect from other people, in the scientific community or medical community. I'm sure that you have to kind of be careful what you say sometimes, but I feel like the term psychic has so much like of an expectation, judgmental expectation built into it. That's why we hate saying that we're psychic. I think it's better to say that we seem to have these gut feelings or moments of, knowing something that is unexplained.
Right.
And
yeah, I agree with you on that. I agree.
And, like I said before, I believe everybody can do this, but some people are just better at it. And, people who have kind of found out how to tune into it are like exceptional at it. And then they get freaky.
Yeah. Yeah, it is.
Like,
It's
when
definitely.
did you know that you wanted to be a doctor?
That's a good question. Nobody's ever really asked that. So I kind of knew all my life. That's another one of those things. Well, not all my, but from childhood. So the way that all got started was I remember going to the doctor's office when I was a kid, and I was amazed and fascinated that the doctor could, listen to me or, listen to my story and then examine me and then come up with a way to treat me and then give me a treatment. And then I felt better. Like that was pretty cool stuff. And then I also thought it was cool, the equipment in the doctor's office. I thought that was pretty neat. And then my mom used to have this family medical encyclopedia. It was like the big deal, I guess back in the '70s or whatever. But it was kind of a encyclopedia of the common things and how you could take care of them at home, kind of deal. And I thought it was really interesting because in the middle of it, it had a skeleton and it had overlays, like it had different overlays of plastic, and there was like the muscles and then the organs and the bone, and the skin. So it was cool because you could peel back the layers and you could look at the different layers. So I was always fascinated with that book and anatomy and the doctor and how he could fix me. And I thought that's what I want to do. I want to be a doctor, and so kind of all my life. So I kind of went up and down as I got to college about do I really want to be a doctor or not. So
Yeah, I love to see a poll of doctors who say that they knew that they wanted to be one from a young age or not. I feel like the pool would be high.
I think so. I think a lot of people it's a calling or it's something you're really interested in. It'd be rare to say, out of the blue, I want to be a doctor, without having had thought about it earlier in your life or whatever.
Mm-hmm.
It's a tough life. It's a good life, but it's a tough life.
Yeah.
It's definitely not an easy thing, and you deal with a lot of good and bad things and all that. So
Yeah, I have no doubt. Anything else that you want to ask? I know the whole tie between psychic abilities and Don over here is very fascinating, but I want to kind of shift gears because I know he has a big interest in the near-death experiences, kind of studying those, and I definitely want to know what he's got to say about it because it's something that's interested me for a long time. So, Missy, is there anything that you wanted to kind of cap off with that line of questioning there before we move on?
No.
Okay.
I'm good.
Don Psychic. Okay. You're psychic now. Sorry, you have to put that in your name now.
Gotcha.
Okay.
It's interesting when you think about what we do as doctors. I mean, we use our education and we use our knowledge base to make decisions. But a lot of times as doctors, we even talk about you got to go with your gut feeling. Like, what's your gut feeling about what's wrong with this patient?
Yep.
So your gut feeling, it is based in science because you're based on your experience and your education and all that stuff. But you'd be surprised. I mean, a lot of docs will tell you, yeah, you have to go with your gut. Like, I got a gut feeling that this is, such and such, and then you got the, you try to build on that. Then, but there is in a way, a quote unquote, a psychic or feeling base. What we do as physicians, you're trying to get the overall feeling. You're using your education, but you're also kind of feeling the vibe, maybe indirectly, and coming up with what you think the diagnosis is. There's a lot, it's a big thing. If you ask a lot of doctors, hey, what do you think about gut feelings? They'll probably say, yeah, you got to go with your gut feeling.
Yeah, I think all good doctors will say that. Absolutely. Yeah. All right, cool. So near-death experiences, super duper interesting when it comes to the anecdotes that you find in our existence of, when it comes to life after death. There's something going on, Don. Right?
There is. And that's probably near-death experiences are probably one of the most compelling things for an afterlife. If somebody says, where's the evidence? If you look at the research in near-death experiences. Now, I haven't done my own research. I've read a lot about it, and I know at the University of Virginia they have the Division of Perceptual Studies program where they do a lot of research on near-death experiences. But the idea is, you die or you nearly die, and you leave your body and have all these experiences that come back. And a lot of people, skeptics of near-death experiences, argue, well, it's the lack of oxygen to the brain, or the medications, et cetera, et cetera. But there's things that happen that are part of near-death experiences that you can't explain by those things.
Yeah, and like, isn't the oxygen like debunked? Like, you can't have vivid, experiences when you're like lacking oxygen. You're in a
Right.
you're almost like in a coma. It's like blackness when when you choke yourself, you go black. You don't have experiences.
Yeah, a lot of times we know if you have a lack of oxygen, or if you have a diseased brain from medications, you're usually confused, combative. You're not, as far as we know, people aren't reporting in those situations, reporting these vivid, epic experiences that they're having. In fact, a lot of times when you get somebody out of a delirium or out of the something like that, they don't remember anything. So there's a difference between that and then what people report in near-death experience with these amazing, details and all those kind of things. And near-death experiences, no two are the same. One person may only have a little bit like out of body and that's it. Some people have the whole, go through all the phases of a near-death experience. And so each one's kind of different for people. And there's even people that have had a couple near-death experiences, and both of those were different at the time. So, but yeah, there's a lot of good research out there that makes you think that our consciousness survives after our bodies die, and near-death experiences are definitely one of those.
Have you listened to anything that Eben Alexander, or read his book? Have you looked at his case?
Yeah, I read a part of the book, but yeah, that's a good story with him because he's a neurosurgeon. He was a neurosurgeon, and neurosurgeon guys are probably your most science-based, skeptical guys you're going to come across. For a neurosurgeon to speak up, like that, I mean, it has to give some a lot of weight to it, his experience, because the surgical docs tend to be more science-based, research-based, a little more skeptical on things, and especially neurosurgery. That's like the top of the top as far as,
well, they're dealing with the brain. They're like the experts on what the brain can and can't do.
Right.
Yeah, if you have spinal meningitis as bad as he did, you're not seeing anything. You're not remembering anything. The middle of your brain is barely operational. You're barely breathing. Your heart rate's barely there. It's a fact.
Right.
And the whole point of his story is not only for a while, what he called the earthworm stage, he would come out of that and go back in, and come out of that and go back in, and there's these musical notes. If you haven't heard of this story, there's YouTube videos. He's got a book. Definitely go check it out.
I got the book. I started reading it. I didn't get that far into it. But let me hang on. So let me grab you guys. Let me show you something real quick.
Uh-oh. He's gonna show us something. Okay. Pay attention, everyone. Uh-oh. See, he's got the books. He's got resource material. Nothing better than resource material, right?
That's right. This book here, I don't know if you guys, by Jeffrey Long. It's it's Evidence of the Afterlife. Jeff Long was an oncologist and started researching near-death experiences. He has there's a website called the Near Death Research Foundation, and you can go on there and document your experiences, or you can read other people's experiences. But he's done huge projects about near-death experiences, and he talks about all the steps of it. But this is a great book, pretty recent, about near-death experiences. I actually use this when I do post on my Haunted M.D page for information. And then Dr. Moody's book on near-death is this one here, The Life After Life. This is a classic one if you're interested in near-death. And then Dr. Greisen, the UVA, has a bunch of books. But yeah, when you look at all these different docs, and all these guys are docs. So Dr. Moody was an MD, Dr. Jeff Long's an MD, and then Greisen's an MD. And so there's good evidence that consciousness survives. Talk about near-death experiences. And the thing about near-death experiences that's interesting, well, the whole thing's interesting, but people can report stuff while they're out of their bodies that can be verified when they're back in their bodies. They'll say, I saw the doctors put something in the drawer, or I was out listening to the nurses talk, and the nurse had this and this at the nursing station. Or there's one where a girl had a near-death experience. She floated outside of her body, outside the hospital, and she saw a tennis shoe up on one of the smaller roofs of the hospital. And she was back in her body. She reported that, and there was no way that she could have known that this tennis shoe was up there, except
Hmm.
that she was out of her body. So you get those kind of details that you can go back and confirm that. I mean, how do you explain that as a lack of oxygen in the brain, or or the dying brain released a bunch of neurochemicals or whatever? So there's those kind of things that you can go back and verify that are objective evidence.
Absolutely. There's no other way to explain other than the fact that they saw it. They saw it. They reported it. They tell you where it is. They're on the table dying, but they're seeing a shoe on the roof.
Yeah, I had a patient of mine. This is probably about 3-4 months ago. I had been taking care of him for a long time. I work in a long-term acute care type situation where people are on ventilators for like a month or so, or they got bad wounds, or they're quadriplegic and got issues. But I had this man who had crashed his car. It was like 20 years ago, and he keeps having to come back in the hospital because he gets infected wounds and those kind of things. But when he crashed his car, he was out of his body, and he could see what the paramedics were doing, exactly what they were doing, and the tools they used. In fact, and he remembered all that. And when the paramedics actually came back and visited him, once they realized, he was able to talk and all that, and he started telling the paramedics, like, "Yeah, I saw you. You were doing this and that, and you had to cut this, and my leg was like this, and all this other stuff." And they were blown away because they're like, "Wait a minute." They go, "How did you know? How did you see all that?" He goes, "I was out floating above you," and the details were right on. And so that kind of stuff is just amazing to me. And then people are like, "Well, there's no evidence. There's no evidence of the soul survives." And I'm like, "There's a lot of evidence. There's a lot of that there's more to the soul surviving than we think."
Have you, this kind of changes gears, but kind of stays on topic a little bit. Have you ever heard of Stuart Hameroff's uh, proposal about consciousness and how the microtubules in the brain
Yeah,
cells?
yeah.
If you looked into that a little bit, the
I
Oracle.
have. It's been a while, but yeah, it's really interesting.
Yeah, so the idea that consciousness survives or is separate from the body, separate from the mind, as they say in the medical field, it's dualism at its core. So if dualism is in fact what is happening, the body is not, the consciousness that senses it's aware of the outside world is not dependent on the body. And, of course, some senses are dependent on the body, but consciousness itself is fundamental. It's not, just a computational emergent phenomena from, the brain. And that's been the argument for years. And that's why I like what Stuart Hameroff and teamed up with Roger Penrose. They have a book and they do, travel the world and do speeches and try to further the research. But it seems like if the brain is a quantum computer, okay, essentially it's doing computing on a quantum level. If all the quantum information in the environment, if quantum field theory is true and all the information that's interacting with everything is stored there, it seems like that could explain all the stuff that we're calling paranormal, like psychic intuition, picking up on things, seeing things before they happen, having a feeling what's going to happen, a whole host of things. Even with this, consciousness being outside the body, it seems like if you study the quantum, all the answers are seemingly there. You know where I'm going with this, right? So what do you think about all that?
I think it makes a lot of sense. That yeah, that the consciousness, it's in the brain, and then it can get out and survive. And there's so much, there's a lot of it. There's a whole energy field and a whole lot of space around us that potentially our consciousness could go into and continue on as a quantum energy. So yeah, I think there's definitely something to that. It's been a little bit since I've read on it, but I was kind of reading up on that. And then I think you and I talked about this too, about the idea of like dark energy and dark fields. And there's so much there's so much area and potential space where if you know for our consciousness or the energy inside of us to go exist outside of our body once our bodies are kind of done and all that. So it's definitely it definitely would help explain it. Yeah.
Right, and it kind of go further with this. If consciousness does survive outside the body, it seems to me that it would make sense for the whole concept of the soul. It would tie in the whole afterlife because Stuart Hameroff's theory is that there's a quantum soul, and I think there's there's a whole paper on the quantum soul. You can look on the internet, and if you have not, folks watching this video, I know I've said it a bunch of times on these shows. Go look at that stuff, even if it feels like it's hard to digest. Please give it a try because it's the best. It's the best and only theory of consciousness that actually exists. Other scientific fields don't even touch it because they don't know how to describe it or define it. You can't go into the brain and say, okay, that part of the brain sees the color red. They can't find it. For example, they can't find consciousness in the brain. They can barely find memory. It's eluding science. It's almost like consciousness is paranormal in itself by definition. And that's fascinating to me. And hopefully we can kind of break away from the boundaries that's kind of caging in our concept of consciousness being an emergent phenomena and, just from the brain. I feel like once we get over that, we start looking at other fields of study, on the quantum levels and what the brain's actually doing. I feel like that would be the breakthrough, of not only paranormal study, but study of understanding consciousness altogether and maybe why we're even here. Like all the existential questions we have, like, why am I here? Is there an afterlife? All that stuff there would be an explosion of knowledge coming from that.
Yeah. Well, I think another interesting thing too. I think about this occasionally, and actually last night too was, we think about the afterlife all the time, but what about the before life? You know, you know, uh, we have to, if we say that we exist after we die, we must exist before we're born. It's kind of interesting to think about it on that side of things too. It's really the
Mm-hmm.
same thing, but it's like, how does the consciousness get into the body, and how is that designed, and how does that happen? So it's interesting to think about that too, and kind of this
Well, there's a near-death
afterlife.
experience story. One of the most popular ones, James, the fighter pilot story. You know which one I'm talking about, right? He was at Pearl Harbor, I think it was.
Yeah,
And
he was a bomber.
yeah, he was a bomber, and his name was. There's this boy named James, and the bomber's name was James. And when James died, he told the little boy that he was flying around in the air essentially, and he picked the mother that he saw a mom that was pregnant with an embryo, and he picked that uterus to pretty much possess.
I think
That's
I
what
do
he.
remember that.
That's
Yeah,
what he
yeah.
told the boy. And that the boy innately knew that. And if you think about it, I'm sorry to interrupt but when you're hitting on this thing, if consciousness, exactly, if it survives death, it's got to be before birth. So the only thing that's really different is the modulation of the soul. Memory is modulating the personality and the character of this soul. It's just the modulation and a characteristic of it. So once
Right.
the body dies, it's just a modulation that goes back to baseline,
Yeah,
on
that's,
a vibration.
yeah, that's a good thought. Well, too, what kind of building on that is, another argument for survival consciousness is, children with previous lives and
Yeah.
reincarnation, and that's the the cool thing about that is that's another situation where you can go back and verify things like these kids know stuff that they shouldn't know. There's no way they should know it, but they could tell you like I lived on this street, or that was a playground, or I had this friend, and you can go back in the record and track people down and track places down that's there and they're correct. So that's what's pretty powerful when you think about near death experience. Well, reincarnation and near death experiences. Those are situations where you could objectively verify certain parts of things. So it's
Uh-huh.
hard to say how do you throw that out? How does this 3-year-old kid know all these stuff, or a 5-year-old kid know all these things and information and people and places and he's never been there, and it's like Yeah, I guess it could be just random luck or whatever, but
Nope.
to me, it suggests that something else is going on. So
There's too much anecdotal evidence to ignore. Just like with the near death experiences. I know you said that a lot of them are different, but the elements in them that are the same is intriguing. Like seeing the light, the tunnel, having the life review, like the flash before the eyes. I mean, so many people has experienced that, and they've never met each other. It's not like these stories are influencing all the other ones, and that's where it's coming from. No, you would be silly to be skeptical of everything that that seems to be connecting the dots with this stuff. And I feel like even if you're a cynic or a skeptic, deep inside, everyone knows that there is a right and wrong. Right?
well, you hope so, yeah.
So, just learning what's right and wrong growing up, there's a process of understanding that you can't do this or there's consequences. But once that empathy forms in a young man or a woman, they know what's right and wrong. So where does that come from? If you look into the studies of Carl Jung,
Right.
he proposed a lot of interesting things about the connected subconscious and the shadow self. Excuse me. And all the things about the archetypes he talks about, and things that are universal symbols, and all this underlying stuff deep embedded in the consciousness that doesn't pertain to the classical world that we know. How we're all interconnected. A lot of people know this, whether they like to argue, the facts about, ghosts, life, life after death, whatever. People know there's this intangible stuff that has no explanation other than there is no explanation for it.
Right. But do you think though, what if somebody never learned right and wrong? What if you were like isolated and you never learned right and wrong? Do you think you would innately learn or feel what's right and wrong? What if nobody ever told you this is wrong and that's right? You think people would learn? Do you think it would
One way or
naturally be?
another, Don, I feel like if you're completely isolated from any interaction with another consciousness, even bugs, animals, nature itself is alive. And innately, I believe that, any mammal or animal like we are will have some type of interaction and connection with its surroundings, with other life forms. It's natural. Okay. Now, some people are born broken. There's serial killers and psychopaths out there. That happens. But for the most part, it doesn't. That's an anomaly. So even if, hypothetical, you stuck someone out, a young boy out on a desert island or a tropical island, whatever, there's still other life and other things for them to interact. And they do still learn a code somehow. They'll know if you don't take care of this part of the island, bad things will happen. Or if you do this, the animals will die or the plants will die, and that'll take away your resources, or, so on and so forth. So I feel like there is a dynamic that kind of helps you learn what's right and wrong. But I feel like there's just a built-in, how some animals just walk soon as they're born. It's in their genetics. I feel like genetically there's code giving us information that we don't have to learn, like math. That's kind of what I'm getting at. Like over the course of evolution, we know things right out of the womb, and we assess them and make them better as we grow. But I do feel like even in the most extreme circumstances, there should be some type of code of honor or ethics that you learn, just on a survival basis.
That makes sense. Yeah, you learn to kind of appreciate and care for things.
Yeah, because if you don't survive very well.
No, you don't. Cool, man. Interesting things to consider.
Spirit Stalker's like, Justin's talking smart now. I have to. Don's on the show, okay? Because, I know, nerds like they use their brains. I like to think that if they had these questions and they, all that mountain of books behind him, all the, faculties of information that he has at his disposal is vast. So I have to have these conversations, and you have to start going deep with them because I can't stop. I have to learn more. I have to know more. It's what keeps me going, man.
I was impressed with you, man, up at Gettysburg. You really know your stuff. I work with a lot of folks, a lot of good folks, but I think as far as kind of like really having tuned into that, like a good knowledge base. I mean, you definitely have a good understanding of things and the theories and all that kind of thing. Instead of just going out looking for ghosts, I mean, you've really thought about it, probably more than a lot of people have. But
I appreciate it.
Yeah. I mean, I know stuff, but I'm just chill. I'm chill. I'm actually learning too. I learn from everybody. I learn from you, and actually you stimulate me to think about things. And hey, I probably should know more about this and than I do and stuff like that. And a lot of things too I read about, then I have to go back and read it again. Like for a while there, I was reading about the quantum stuff a lot, but I got to refresh on that and stuff. But no, I'm not. I'm just chill.
Yeah, dude, I totally get that from you, and I think that's one of the most likable qualities, that you're very down to earth, grounded. You're very cordial with people. You don't, there's no ego that's really abrasive to anybody, and I think that's super cool, man. I think that you need to get that study going. Should we talk about that? Should we talk about that? Because, we talked about the near-death experience. What is the next step? Like, we're missing, kind of what McDougall was starting with, weighing people and seeing if they weigh less on the deathbed. I think that there's some ethical problems with that, but still would be interesting to kind of to go forward with that. But on another note, we were talking at Gettysburg about in a hospice situation, or, in a place where people were terminally ill, they know that they probably have a very short time on this earth left. What if you did a group study with these people, or different, facilities with these situations, on would them be an experiment where they would be like, okay, this is a code word that I will use, or this is something that I will give you as information, a message beyond the grave. If it's me, this is what it is. For example, there's probably people way smarter than me that can come up with better examples. But if we can predict what could happen and then get those results and replicate them in different case studies, independent from each other, what do you think, man? Is that missing? Do we need that in the paranormal research field to kind of give us more information, or proof that there is something reaching back beyond the grave, back to us, validating that those have left us are still there?
Yeah. Yes, I think there's a couple ways to look at it. So I think one thing that'd be interesting is, like I talked to you at Gettysburg about, is actually being, can we measure something changing when people die? Like, could we be there at the bedside with special permissions and privacy and all that kind of stuff? But could you be there and actually try to record when somebody, right, was at the time of death? Can we measure an energy change? Can we see something visual? I don't know about the weighing people kind of thing. I mean, you could try. I mean, that's another thing. But I think it'd be cool to do some kind of project, with ethical projects, with permissions and all that kind of stuff, where you're trying to measure data when people die to see, can you measure something that's happening? So that's one aspect of it. And then the kind of what you're getting at, I like too, is can you communicate with somebody that's with it enough at the time of death, say, hey, this, can you let's make up a word or a signal that I know it's going to be you, and you're going to let me know that you're communicating back. So that would be another way to look at it too. So I think on one hand, it'd be cool to see, can you measure something at the time of death, and then can you have them be able to communicate back and all that kind of stuff. So yeah, I think that'd be cool to do those kind of projects. It'd be a little tricky, but I think the hospice type setting would be a place where you could potentially do that. You know, as
Mhm.
long as you set up the right kind of study and get the right permissions and all that kind of thing. I think you definitely got to be respectful of the families and the patients. But I think if all those things are covered and you know, you're doing everything right and doing it for the right reasons, I think it would be a good study. And I think I told you I'd like to, you know, we always debate about what is our equipment picking up on, you know, the K2s and the SLSs and all that stuff. It'd be cool, you know, they actually have some of that gear available to see. Can I measure? Does the equipment record something when somebody dies? Like when they die, can I just pick up on an EMF field? Can I see a stick figure rise out of the body? You know what I mean? Like, so it'd be cool to be able to do that or not. You know, or not, there's nothing to be recorded, nothing when somebody dies.
Mhm.
I think that'd be interesting to do that kind of study. And I've kicked it around and I've kind of chickened out here and there with it because of the, you know, making sure all the ethical kind of things. But it's still something I'd like to do. I think hospice would be open to it. And I mean, hospice people, hospice nurses and physicians, they all have their stories, and family members that are present when people die, they have their stories. So there seems to be something happening. The question is, we we can we document that more objectively, you know, and be able to repeat it and say, yeah, look at there's energy or there's something that leaves the body for sure. And then I think the other part would be like what you said about communicating back. Can you, you know, flip the light 3 times? Or could you say a word that we talked about? Or, yeah, come in with some kind of code that actually could validate that there's life after death.
So we're going to riff on this for a while. So an example I can think of to cover the ethical side is not only do the person who is terminally ill have to agree with this, the whole family has to.
The family does too, and then even you got to make sure the organization too. Like,
yeah,
if you're working with a health system or if you're working with a hospice, you have to make sure it's all on the up and up.
right. So bedside apparitions happen in hospice, and people who have died without anybody knowing, and they get visited, and they're like, "Oh, I seen Ed." You know, you couldn't have seen Ed. Ed died 5 minutes ago, or 5 hours ago, or a day before.
Really? Yes.
So.
Yes.
So a lot of these studies that I have looked at recently saying that not only are people in hospice seeing the bedside apparition phenomena, they're seeing people that were in their room or in their ward after they've died visit them right before they pass. So that could be something that you could use as a potential, variable. Hey, do you agree that if you pass, that could you tell your roommate that you roomed with, or a person that you know that you're friends with in the hospital, to give them a sign? But you can't let them know, obviously. It would be a double blind. But leading back to all the stuff you were saying before, can we measure something? So, the McDougall's experiment, if anybody's not familiar with it, he weighed folks that were passing away, and some of them lost 21 grams, some of them didn't. There was a lot of problems that kind of came out of that. But what I found interesting was that the 21 grams didn't seem like it was random, because when I did crunch some numbers, if you take the average weight of a person, around maybe 180 pounds, I don't know what the average weight of a person is, but 180 sounds close. If you get a skinny person or an obese person, 180 might be in the middle. So if you weigh all the electrons in a 180 pound person, guess how much that weighs? How much does it weigh, Don?
Well, the 21 grams, but they did it in it was a 70 kilogram person, about 140, 150 pounds. So yeah, but yeah, remember people is gonna vary with their.
Mm-hmm.
Yeah. So
yeah.
My electrons could be a lot
right.
more than that.
So where I'm going with this.
It is interesting, though. It is interesting. But yeah, the McDougall study it's interesting, but it was not a good one.
No, but if there is an electron discharge, because if anybody knows anything about static electricity or electron exchange, you quickly gain that back through, a static arcing. So if there's an electron discharge, immediately upon death, you will grab all those electrons back. It'll arc back to you, so your atoms will have this, balance again. So that's why you kind of get shocked if you rub your feet across a carpet and grab the doorknob, you get shocked. You're borrowing those electrons that you stripped off of your feet, scraping your feet across the ground on your way to the doorknob. So if you could set up an apparatus or some type of study to see if there's an electron discharge at the moment of death that would equal all those, or not all your electrons, but some of your electrons, I think that would be interesting, because if you have a field of electrons moving in an area, that's going to cause an electromagnetic field spike.
Right.
So that could be a reason why we get those, when, go into haunted places, or when, strange, ghostly activity happens, you get those anomalous spikes. But we won't know until we test, like you said. We need to test things.
But I know on a, from a subjective standpoint, I've been present when people die. I mean, that's one of the things I talk about being a doc. I kind of got into this, but we didn't talk about it a lot. Is I do internal medicine, which is age 18 to the time people die.